Dr. Frederic Menu. I come from France. I'm the president of the French Society for Hair Restoration and Surgery and member of the International Society of Hair Restoration and Surgery. I work for the French Medical Center and come to Doha every month for a couple of days to do hair transplant with the technique FUE. The FUE technique is the follicle-unit extraction technique, which is the opposite of the strip, which leaves a long scar. The advantages of the FUE is that we harvest the hairs one by one with very small punches in order to have a very small scar. The best option to harvest is to use the 0.8 millimeter punch, which needs a lot of experience because many people harvest with a 1 millimeter punch. With 1 millimeter punches, you may have scars, but with 0.8, it is very discreet. Once we harvest the hairs with 0.8 millimeter, this is done under local anesthesia. The patient is awake during this procedure. It is totally, they don't feel any pain. And once we harvest the hairs, we plant them one by one in the recipient area. Being able to harvest with a very small punch allows us to have very small hairs, which can enable us to have the best density possible. The patient you previously saw was a 29-year-old male patient who had hair loss since his teenagers in the vertex, which is the spot behind, over the horseshoe-shaped area. We harvested the hair in the safe donor area, which is the area where the hairs stay all the patient's life. They'd never fall. And we plant them in the area on the vertex. The particularity of this patient was here on the vertex there is a twirl zone, so you have to follow the orientation of the hairs. Each area has hairs with different orientations. So we harvested almost 2,000 hairs in order to cover this area which needed a good density.